Good Monday morning, everyone. Today I am here for our summer Facebook Live series with Dr. Lauryn Beecher from Health in Balance Physical Therapy. So today we have a lot of good information to share with you all, and I'm going to start off with an introduction, introduce Dr. Lauryn Beecher. Lauryn is a Milwaukee native who received her Bachelor's of Science in Exercise, Sports Science, and Spanish Language from the University of Wisconsin-La Crosse. And she went on to earn her doctorate in physical therapy from Mount St. Mary's University in Los Angeles in 2018. While in graduate school, she discovered her passion for holistic practices while completing her 200-hour yoga certification and treating the whole person, including those with pelvic health concerns, in addition to being trained as a pelvic health physical therapist via Herman & Wallace. She is also a BirthFit professional and is working towards certification in dry needling with myopain seminars and visceral manipulation with the Barrel Institute. She has experience treating people of all genders with pelvic pain, incontinence, prolapse, and pregnancy and postpartum related concerns. Her treatment approach involves individualized one-on-one patient care as her priority and is helping each patient feel inspired to take back control of their health and get them back doing what they love. So welcome, Lauryn. I'm excited to have you on. And pelvic health physical therapy is a specialty that not a lot of people know about, but most people should know about it. So I'm excited for you to share some more information. So could you describe what you do as a pelvic floor physical therapist, pelvic health physical therapist?
Yeah, so first off, thanks so much for having me on this morning to talk about what I do. And because you're so right, so many people don't know that this is something that physical therapy can help with, and there are a lot of people who could benefit from that knowledge.
Definitely. And how did you get into this specialty?
Yeah, so while I was in grad school, I was fortunate enough that I had an entire class and not just a couple of lectures dedicated to learning about what a pelvic health physical therapist does. So that class kind of just grazed the surface of things. But a lot of the things that we were talking about, I realized that a lot of the women in my life, a lot of the moms I'd worked for over the years, a lot of my friends who had babies, they were suffering from issues like incontinence, like prolapse, like low back pain that just hadn't gone away since they had their child or since they were pregnant. All things that they were just kind of learning to deal with, and had been told by either their mom or a friend or a physician that it was normal, that they had a baby, kind of like, what did you expect to happen? You had a baby, things change in your body. And they didn't know that there was help beyond wearing a pad, beyond just continuing to deal with it.
Yeah, definitely. I think that is a really common, it's a common concern that a lot of people deal with, but that is not addressed in perhaps conventional medicine or just the misconception among friends, like this is normal. But although pelvic health issues are common after pregnancy and having a baby, they just are not normal. And there are things that you can do to help regain function.
Exactly. And that's just what I'm here for. So thinking about that idea of it's never too late, whether you're currently 36, 37 weeks pregnant and just started to notice that you're leaking urine when you sneeze or cough, or you're in your 90s and you're waking up several times a night because your brain is signaling your bladder that it has to empty. So it's never too early, it's never too late. There's always help.
Great. So you deal with women then in a wide age range. What would be the youngest patient you see, and versus what's the oldest that you've personally seen?
So just at the beginning of this year, I actually started treating children. So my youngest patient, I can now say, was 5 years old. And my oldest patient was 92. So kind of working with people across the spectrum of their lives, it's been a little bit of a challenge, but a lot of fun, because so many of the principles that we use of, okay, let's take a look at how much fluid you're drinking, how much of that fluid is water. Let's take a look at how often you're going to the bathroom. Little things like that, they're pretty true across the board and can help you whether you're 5 years old and want to play on the playground without leaking, or you're in your 90s and want to be able to make it to the bathroom throughout the day or throughout the evening without leaking and having to change your clothes.
That's wonderful. So it seems like different age groups, you see different age groups, and do you do different things, like different types of therapy? Or could you paint a picture of, let's start with, let's say a woman postpartum. How would you do an exam, and how do you actually do physical therapy on the pelvic floor area of the body?
Yeah, so I'd say the vast majority of the people that I see identify as women. They have either recently had a baby or they're currently pregnant. So most of the time, women in their early to mid 30s or early 40s. And the first thing we do is we talk. We have a long conversation about what they're experiencing. We talk about their bladder health. So, how frequently going to the bathroom? When you go, do you feel like you can get there in time? Are there things throughout your day that make you feel like you have to go to the bathroom even though you just went? Um, Things like that surrounding your bladder habits. We talk about how much you're eating, how much you're drinking. We talk about your bowel movements. So we talk about some things that might be a little more sensitive for some people. It helps us to paint this picture and figure out, okay, what exactly is going on so that we can tailor a treatment plan specifically to that person. So the first day that I work with someone, the first piece of homework that I always give is something called a voiding log. So it's anywhere from 3 days to 7 days, depending on if we're working on more bladder issues or more bowel issues. And I have people keep track of, okay, what are you drinking? What are you eating? When you go to the bathroom, how strong is the urge? How frequently do you have a bowel movement? Things like that that give us some really structured information. Because I know if you asked me, okay, Lauren, what time did you go to the bathroom this morning and how much did you void? I could give you a ballpark estimate, but I wouldn't be able to be overly specific. And that's what helps us get started at first.
Okay, great. So when you first see a patient, you go through all of their main concerns, and then you might give them the voiding log, or you always give them the voiding log to keep track of. And then when you actually do physical therapy, is it something that you're just describing on how to strengthen certain muscle groups in that area of the body? Or do you give them at-home techniques that they should be doing? Or what does a treatment plan look like?
Yeah, so again, it varies a lot depending on exactly what someone's coming in for. So, for instance, if they're coming in with pelvic pain, it's going to look very different from if they're coming in and saying, every time I walk in the door, I have to race to the bathroom. So, for
Okay.
people with more of that urge incontinence, needing to rush to the bathroom, we're doing a lot more of like behavioral modification techniques. So we're figuring out, okay, what are your triggers? Is it pulling into the driveway? Is it hearing the washing machine running? And figuring out what works best for you to kind of calm down that sensation so that you can have control. For someone who leaks when they sneeze or cough, or is experiencing pelvic pain either with penetrative intercourse or with a medical exam, it's really important that we take a look at how the pelvic floor is functioning. So the assessment that I do with someone is very different from what an OB or a gynecologist or a urogynecologist would do, but we're still assessing the pelvic floor muscles. So I wear gloves, and I have the person that I'm working with undress from the waist down, and we check to see, okay, When you breathe, does your pelvic floor move a little bit? When you try to do a Kegel or try to squeeze your pelvic floor, does it lift? Does it lower? When you try to bulge or lengthen like you're having a bowel movement, what can you consciously tell your pelvic floor to do? And then we check and see, do you have any pain, any tenderness? Does the soft tissue at the vulva move well? Are there areas that don't move? Is there scar tissue from an episiotomy or a tearing with birth? And then we do the same thing internally, seeing, are there areas of the muscle that don't move well, that are tender, that are uncomfortable? If a lot of redness or skin irritation, I'm asking a lot more medical history questions. Would it be beneficial to do some type of hormone replacement therapy because these tissues are so soft or fragile? Or is it more muscular? These muscles are holding on really tight, and we need to help them learn to relax and lengthen a little bit so that they work better.
Okay, great. So it seems like the internal exam that you do, although in some ways it's similar to, let's say, going to a gynecologist, but a gynecologist isn't actually looking for muscle strength or tone or what is dysfunction on a physical level, whereas you're focusing on, are you able to have the strength in all the proper muscle groups without anything being too tight either? Would that be a good way to explain it as well?
Exactly. Yeah. So we're looking at strength, we're looking at coordination. Our big goal is function. So I don't use a speculum at all because that blocks our view of the vaginal vault and how that's moving. Because I'm not the one who's checking and doing like a swab for cervical cancer or things like that. Our purpose is very functional and very different. And then depending on what we find and what you're experiencing, that's where we move forward with treatment.
Okay. Now, it was the exam that you just described. Would that be suitable for any of the patient populations that you've already mentioned? Or what would an exam look like for a child?
Yeah, so for a child, it's very different. We don't do any internal work with a child. Anybody under the age of 18 is considered pediatric. And even then, if someone is older, even well into their 30s or 40s, or even older, if it's not in their comfort zone to have a therapist assess their pelvic floor muscles, I'll talk them through how they can do it themselves, either in the clinic or at home. And there's some ways that we can keep clothes on and see in general how is the pelvic floor functioning. It's not as specific, it doesn't give us as much information, but it can be a nice starting point.
Okay, that's great, because I know some people, maybe they feel really uncomfortable, or especially for children, it wouldn't be appropriate to do an internal exam. So there are still ways, as being a pelvic health specialist, that you can still assess and support the patient with where they're at.
Exactly. So for kids, we're, as long as it's okay with the child, we make sure that they understand what we're doing at an age-appropriate level and it's okay with their parent or guardian. We'll still take a look at the skin and how the muscles are moving. Like I'll ask the child, okay, can you squeeze your little bottom muscles, or try not to toot on me? Little things like that that help them to try to engage those muscles. I'll ask them to pretend like they're pooping. Little things like that to see, okay, what do their pelvic floor muscles do? And then we're using things like maybe a cold balloon or sitting on a towel roll or things like that to help the child engage those muscles. And we're still using the same strategies of, okay, what does their fluid intake look like? What does their fiber intake look like? Are they physically active? Are they playing and running around through the day? Little things like that can go a really long ways.
Wow, that's amazing. So it's pretty comprehensive then. So I would say, when you have children that you see, are they usually being referred by a medical doctor, or do people seek you out on their own? How does that work for insurance, which I know can be a really broad question, but if somebody wanted to seek out care, how must they go about doing it?
Yeah, so in general, in the state of Wisconsin, we don't need a referral. There are a handful of insurance companies that require it after the initial evaluation. So pretty much across the board, you can come into physical therapy without a physician's referral. And I'd find that within the realm of pelvic health PT, most of my physician referrals are from chiropractors or more holistic practitioners like yourself. Because even a lot of traditional medicine physicians, they either don't know that pelvic health PT exists, or they don't know the kind of broad area of things that we can help with. And pelvic health PT varies a lot practitioner to practitioner. So I do internal assessments, I do external assessments, I use biofeedback sometimes, most often with kids. So we're able to see kind of at an electrical level, is there muscle activity here? So it varies a lot. So what you might see in a physician's office is a nurse who says that they're doing pelvic health PT, but they just have someone like sitting on this machine that vibrates and things that aren't really as effective as treating the whole person and looking at their lifestyle and all of the contributing factors to whatever they're experiencing.
Okay, great. So you mentioned a biofeedback machine that you use. What does that look like? What does that entail?
Yeah, so biofeedback, it's these two little patches. They're just little stickers about the size of a dime. And we're able to use them really anywhere on the body. So I've used them on people's backs or on their glutes, or we'll see them used on like somebody's quads after they have an ACL repair. I most often use them at the pelvic floor muscles on the outside. So just on either side of the anus, we're putting just these two little stickers. And what's really nice then is somebody can pull their pants up. We can get up and move. And then we're able to see on a screen, the two little stickers, they're connected by lead wires to this little machine. Okay, when you squeeze, how much muscle activity is there? When you're just sitting here resting, how much muscle activity is there? There should be really low. Same idea. I'll sometimes have people take the machine, go into the bathroom by themselves once they kind of know how it works and try, okay, can you bear down, pretend like you're having a bowel movement? Does your pelvic floor muscle activity go through the roof, or does it stay nice and low? So we're using it as just one of the many tools that tells us, how is your pelvic floor functioning? And can you then see what's happening and carry it over to whatever we need you to do?
Okay, that's fascinating. So in some ways you can kind of reprogram the brain to activate the correct muscle groups if you're able to see it on the biofeedback machine, where you say, okay, if I do this, then this happens. Is there any sort of tool like that that people use at home?
So the most common thing I'll ask people to use at home is a mirror. Pull out a hand mirror or pull out one of like a little like makeup mirror and look and see what's happening. There are also some different like pelvic floor muscle trainers out there. I would say I don't prescribe those as often, but it's kind of looks like almost like a vibrator or a dildo or something like that, but they're usually much softer. And some can be inflated slightly to give you feedback on the inside, so that when you do Kegel or when you do squeeze your muscles, you're able to feel resistance. But most often I say, okay, can you use a mirror? Can you use your own hand? Can you feel what's going on here or see what's going on here? Just depending on how someone best learns. And some people are really, really in tune with their bodies and they know exactly what they're doing when they're doing it once you've kind of worked on it together a handful of times, and they don't necessarily need that mirror or need that tool.
Okay, great. Well, let me see what other questions I have for you. Can you tell us what are some of the most commonly asked questions that you get asked as a pelvic health specialist?
Yeah, I think the most common one is by far, why didn't anybody tell me about this? Um,
Definitely. I tell so many patients about pelvic floor physical therapy and even women, in their 70s, 80s, they're like, that exists. Like I had 6 kids. Why didn't anyone tell me about that? So that definitely makes sense.
Yeah, and it's definitely a field that has like exploded in the last 10 years. So for those women who are more perimenopausal, menopausal age, when they were giving birth to their kids, there were probably only a handful of pelvic health PTs across the nation. So there are
Right.
a lot more of us now, and with all of the online forums and things like that, there's just a lot more information out there and a lot more access to people who are experiencing the same things as you and practitioners who are there to help you.
Cool. And do you know, compared to other areas of the world or other countries, like what's normal in other countries? Do most women get this referral or get this explained to them right off the bat when having a baby, or how does it work elsewhere if you know it all?
Yeah, so it's interesting because in France and Germany, some type of pelvic rehab is standard. I believe in both countries, it starts off as more of a group class. So thinking of, okay, I just had a baby, or I'm right now, I have this group of women who are at this stage in their pregnancy or at the same stage postpartum, and we're sitting together in a group style class talking about what we're experiencing, whether it's leaking when we sneeze or cough, pain with intercourse, feelings of prolapse, so like that heaviness or that falling out feeling at the pelvic floor,
Mhm.
things like diastasis or that thinning of the linea alba or the doming that someone might see in their abdomen. So there's this group conversation so that if it's something as simple as, okay, well, you need to drink more water, or here are some strategies that you can use to help prevent leaking when you sneeze or cough. So it starts off as that group. And then if that's not enough for someone, they're pretty quickly directed to a pelvic health PT or provider who is then able to give some more individualized instructions. Last summer, I worked with a woman who grew up in Germany, and I remember her telling me that her mom asked like when she was going to start her postpartum classes, and she had to tell her mom that she didn't have any postpartum classes, but she was seeing a pelvic health PT instead right away.
Oh, wow. That's interesting. So such a cultural difference that for her mom, it was like, this is normal. When do your classes start? But here, it's
Right.
just not the way that things are automatically done. So it was great that she was able to seek you out and get the support right away.
Yeah, and I think a big part of it too was that she knew that this was something that would be beneficial in her recovery and in her rehab. So at 8 weeks postpartum, she was able to say, okay, I still can't walk as long as I'd like to walk pushing a stroller, and I can't maintain continence throughout the day. So at 8 weeks, my body should be doing this. So I
Mm-hmm.
need some help and I need some assistance, and I know who to go to.
Great. So she was pretty recent. She pretty recently had a baby when she actually came to see you. But what if somebody had a baby, I don't know, 5, 10, 15, 20 years ago? Is there a point of no return where you really can't regain much ground? Or how do you approach situations like that?
Yeah, so I say it's never too late. Um, Thinking of just somebody's quality of life and their ability to do the things that they want to do, whether you're 2 months postpartum or 20 years postpartum, you should never have to deal with pain. You should never have to deal with not being able to maintain continence. So there's really not a time limit on when you can seek help. It's just whenever you're feeling ready.
Okay, awesome. That's great. And could you share some patient success stories with us or big wins, or what value do they get from working with you?
Yeah, I'd say the biggest thing by far is just regaining some self-confidence and some independence again. So thinking about, there's a woman who comes to mind, who was in her early 90s. She came to see me once her daughter moved back in with her, and she was getting up and accidentally voiding her bladder multiple times a night. And it took her daughter saying, "Hey, why are we washing so many pairs of pajamas every day?" For a daughter kind of gently saying, "Okay, something needs to change here. You can't live like this.
Yeah.
This isn't good." For her to come and see me, and we work together as a family to figure out, okay, how can we address this? And they were super consistent. They worked really hard, and she was dry 99% of the time by the time we finished. So thinking of just all of the ways that that impacts your life when you can't just stand up and go about your day without needing to worry about, do I have a pad on? Is it absorbent enough? Do I have a change of clothes? Do other people smell this, or do other people see this? It can be
Wow.
really debilitating and really isolating. So whether it's a couple drops or you need to change your clothes, just knowing that, okay, I can get up and I can go about my day and do what I want to do and be comfortable in my own body, I think is so liberating for people.
Wow, that sounds great. So she was essentially having to change her pajamas a lot through the night because she would leak or have incontinence. And then after working with you and putting in a lot of effort and consistency with a plan, she was really able potentially even to sleep more solidly throughout the night because she didn't have all of those interruptions.
Exactly.
Yeah. That's awesome. And what about somebody in a different age group, a success story, maybe a child or a woman in middle ages? Do you have any that come to mind that were really inspiring?
Yeah, so I think one that comes to mind is a woman who came to me with excruciating back pain. I forget if she had 3 kids or 4 kids, um, but she came in with debilitating back pain, could barely walk, could barely move. We spent a session working on her diastasis, and she stood up, was walking completely normal, very minimal pain in her low back. And this is a woman who hadn't moved normally or without pain in years. So within a visit, we were able to help regain some muscle function within the muscles in her abdomen, get those muscles firing appropriately again,
Mhm.
and help minimize her pain dramatically in just a visit. So we did a lot more work after that. It wasn't like one and done by any means, but
Right.
knowing that it's never too early. So thinking of that idea, if she had come and seen someone after her first baby or when the back pain just started,
Mhm.
she would have had these years where she could have been lifting her kids, getting down on the floor and playing with them, running around with them outside for all of her children, um, and not having to basically put her time on hold with her kids because of her back pain.
Wow. And for those watching who don't know what diastasis is, could you explain that, or how would somebody notice that they have diastasis if they do have it?
Yeah, so diastasis, it's something that like 90% of women, if they're 40 weeks pregnant, they will have some level of diastasis. And what it is you think of your six pack ab muscles, your rectus abdominis. There's this piece of connective tissue that runs down the middle of your belly from your breastbone down past your belly button to the top of your pubic bone.
Mhm.
And there comes a point in pregnancy where those six pack ab muscles can only stretch so much. And then that connective tissue in the middle needs to start to stretch. So when you go to like sit up out of bed or roll over in bed or stand up, or doing like a plank or certain abdominal exercises, you might notice this little bit of like a doming. So instead of your abs being more flat, you might notice this little bulge or like a coning shape, or sometimes even a little bit of a divot in your abs, just depending on how they're firing. And that's something that's completely normal at the end of pregnancy, but by 6 to 8 weeks, it should be pretty minimal. 6 to 8 weeks postpartum, it should be pretty minimal. You might still have a little bit of that doming or coning just as the muscles start to kind of move from that really lengthened position to their normal condensed position. But if it persists past that 2-3 month mark, then it's best to say, okay, let me go in and see a physical therapist, do some hands-on work, learn how to coordinate these muscles again so that I have really good ability to manage pressure throughout my abdomen, so that my back doesn't start hurting, so that I don't start to develop pelvic organ prolapse. Things like that can be contributing factors that you want to think about long term.
Okay, so even though the problem with diastasis is in the front, the six-pack ab muscles, that connective tissue in the middle, for some people they get back pain because of it. But now what if the person has the back pain and they went to just a standard physical therapist and did therapy with them? Our standard physical therapist, I don't know what the right term to say besides standard, just somebody who's a doctor of physical therapy without extra training, do you think they would make the connection and know to refer to someone specialized in the area that you're specialized in, or how does that work?
Some are. I'd say that they're, in general, a standard orthopedic physical therapist should know, okay, this woman had a baby, she's had this pain since having her baby. There are some things that they should know to look for. It doesn't mean that they're going to look for it or necessarily even draw the conclusion of, oh, she had her baby 3 years ago, her back pain started 2.5 years ago. So those are things and questions that I'm really specific about asking, but a traditional orthopedic physical therapist might not be. So more and more orthopedic PTs are thinking about those pregnancy, postpartum, pelvic floor conditions and knowing when to refer out. But there are lots of times where someone comes to me and they said, I've seen 2 or 3 other PTs and they didn't see this. Why? And there's so much that we learn in PT school, that one slide or that one lecture on postpartum conditions might not be something that they think of because they don't think about it every day. So if you are working with a traditional orthopedic PT and you feel like, I'm not sure if I have a diastasis, I think I do, but I'm not sure, feel free to ask them if they know about it. They may not. They should for sure be able to refer you to a pelvic health PT, and then those 2 physical therapists can co-treat together. Maybe you see the pelvic health PT for a couple visits, the orthopedic PT for a couple visits, and they work together to make sure that they're addressing everything that's going on with your body.
Okay, that's wonderful. So as a patient, if somebody has some concerns that now listening to this video, they think, well, I wonder if it was because of, my pregnancy and everything like that. And they've already seen another physical floor therapist, or they've already seen a different physical therapist. They could still contact their physical therapist and say, hey, I just learned some new information. I feel like my condition might be caused deeper in the body, and then they could still seek out care from you.
Yeah, and that's where, even if you haven't worked with a PT before, there are some really great directories online. Herman and Wallace, who I've done most of my training through, they have a directory online that's free for any pelvic health PT register on. So when I'm looking for a friend or a family member or a colleague that lives out of state, that's where I go. The section on pelvic health, they also have a directory Pelvic Guru, that's another directory. So there are a lot of ways to find a pelvic health PT in your area. Your physician might know someone, your chiropractor might know someone that they can recommend. So asking for those recommendations, and if they don't know, heading to one of those directories so that you can find someone that's convenient for you.
That's awesome. And when we get done with the video, perhaps you'll be able to type some of those directories up in the comments and also share your contact information so that people can get a hold of you too if they have questions. I'm looking at our question stream. It looks like we had a few nice comments, no questions specifically. If anyone is watching live right now and you do have a question, feel free to type it up. We'll probably be wrapping up within the next few minutes or so, but if we don't get to your question, or if you're watching a replay, still type it up. You can tag us and we will be sure to respond. Yeah. So Lauren, I'm trying to see if there's any last minute questions I have for you. I'm going to pull up my little reference guide that I made. How can people get a hold of you?
Yeah, so during the week, I work out of Health and Balance Physical Therapy in Mequon. So we're located just about 10 minutes west of the expressway. If you're familiar with the Mequon area, we are right across the street from Outpost. So pretty convenient for most people who live North Shore, Milwaukee area, or even a little further west, like Menominee Falls, Germantown. So I'm here Monday through Thursday, and I'll post our contact information as well.
Great. Awesome. Well, thank you so much for being interviewed today. Thank you for participating and sharing such a wealth of knowledge that so many people need to hear and need to learn about, because it could really have life-changing effects for them.
Yeah, thanks for having me, and thanks for letting me talk about my favorite topic.
You're welcome. I hope you have a great day.
Thanks. Have a great day, everybody.
All right. Bye-bye.